The key questions in advanced colorectal cancer have to do with novel therapeutics and biomarkers. In terms of novel therapeutics, there's a lot of interest in immunotherapy. And we know that in microsatellite high colorectal cancer, which is a small subset, immunotherapy has benefit. And the question really is, should we use one or two at a time? And what are the best predictive markers in those patients? And frankly, how long should we give them? Is there a point where we can stop? For the vast majority of patients, however, they're microsatellite stable and immunotherapy has not been effective. And so there's a lot of interest in phase 1 and phase 2 trials to try to pick up combinations of immunotherapy that will turn colorectal cancer microsatellite stable from a disease where immunotherapy has not been effective to a disease where it can be effective. Unfortunately, there was a press release recently of a combination that had some promise looking at a PD-L1 inhibitor and a MEK inhibitor, and unfortunately that trial was not positive. And so I think the hunt will continue to try to find some type of immunotherapy combination that will be effective for microsatellite stable colorectal cancer. There's also a lot of interest in biomarkers in terms of targeted therapies. For instance, can we use circulating tumor DNA from blood tests, which hopefully would represent the overall tumor burden in a patient rather than biopsying one lesion or another, which by the way is invasive, can have complications and is more expensive. Can we just use a blood test to guide us in terms of what would be the best therapy? And finally, the other thing we're seeing in 2018 is sequencing questions. So should we use drug A before drug B or drug B before drug A, and what is the difference in outcome when we do those types of things?